Thank you very much, Maz. Now let's cross to Zimbabwe, where senior doctors are on strike in support of their junior colleagues. They're protesting over the sacking of over 400 junior doctors in what is a protracted strike over poor wages in the worst economic crisis in years. Now today, they've released a statement saying that the government hospitals have become death traps, lacking even basic equipment. Dr. Naguse is the president of the Senior Doctors Association, and I asked her why senior doctors are striking.
First to say, we are not on strike. We feel we are incapacitated to be able to deliver our duties, both financially and in terms of tools of the trade to use when we do get to work.
Incapacitated to do your duty, why?
One, in terms of the salary we're receiving. As you might know, the juniors have not been able to report for duty since September. So most senior doctors have continued to cover emergencies as best we can. But in the past 2 months, the employer has been withholding salaries for most senior doctors. So we have been coming to work at our own expense in order to give patients some kind of service. Well, we were in negotiations during that time, but the employer has then gone on to institute very punitive disciplinary measures against both the junior and the senior doctors. So we are no longer able to continue to offer that service.
And obviously we're talking about over 400 junior doctors who have been fired from their position for withdrawing their services. Talk me through, or give me an understanding of what it's been like for you as a senior doctor on a busy shift where you have people coming in and out of the hospital needing treatment. What's it been like? Describe those conditions.
The inflow of patient traffic has significantly reduced, because already before, when doctors were there full time, there were issues of lack of drugs and poor equipment, whereby the patient would get admitted and their relatives get given a long prescription, which they have to go buy at a private pharmacy, then bring the medication back. So already patients were reluctant to come. So the withdrawal of service then compounded that further.
Yes.
So the inflows have been reduced, but when patients do come in, obviously, one doctor is doing everything from the admission, taking of bloods, investigations, preparing patients for theatre, doing the operation, post-operative care, and the follow-up all by themselves. So It has been quite hectic. And all of that without a salary for the past month especially.
In a statement from senior doctors, you said, not you specifically, but the organisation supporting senior doctors has said that a silent genocide continues to be perpetrated upon the people of Zimbabwe. But equally, many people are being turned away. Some have been essentially sent home to die. Talk me through that moral dilemma that you now face as a doctor, because ultimately you have taken an oath to support vulnerable people in precarious health conditions. And here you are saying, I'm no longer going to work.
If you read through our statement, if you remember, in March, we had a quite low-key, localized, what can I call it, demonstration to highlight the dire situation in the hospitals in terms of drugs, consumables, equipment, whereby we had antibiotics like metronidazole, which is not even being used in some Western countries anymore. But that's like a very low level, entry level antibiotic. So we highlighted that. We talked to the ministry, said they were sorting things out. There was a lot of publicity where money was availed from Treasury. They flew off to India and supposedly bought stuff, whole consignments for the hospitals. There was a lot of ribbon cutting, but basically nothing materialized from that whole consignment. So this is from March that we've been working, patching up the system, trying to work where you don't even recognize anymore the kind of medicine you're practicing. Patients are coming in, take a patient to theatre, you use sutures that you know you shouldn't be using, you don't give them antibiotics that you know they shouldn't because they can't afford them. You have to decide, okay, should I just do bush medicine or let the patient just die? We do our bush medicine, the patient dies a few days later anyway. And so now it's reached a point where, people are like, I'd rather sit at home and let the people of Zimbabwe know that there's nothing for them at the public health sector.
And
while we were there, the patients were dying.
And doctor, do you believe that senior doctors going on strike will be enough to push the government into action, considering the fact that your country is facing a dire economic situation? There may not be the resources, this is what they might say, to further assist the medical industry. Is this going to be enough to sway the government?
Well, as I said, we've been in this economic situation for a long time. So in March, that money was released. But our point is it completely disappeared into the system. It had no effect at institutional level. So those who released the money then, why can that not be followed up? It should be retrieved from whatever hole it disappeared into. So we believe that there is a lot of leakage in the systems across all levels of the health sector. We don't necessarily believe that we need new money, but there is so much inefficiency and so much leakage. And as well, if government feel they're unable, there are many, I'm sure, organizations willing to assist them. But what we are saying is, on an individual level, we cannot continue pretending to be treating patients when we know we are not.
And my final question to you is, how long will you continue with this type of protest, considering so many lives are at risk?
Well, we hoped never to come to this stage, but as we also mentioned in our statement, as we speak, the ministry is handing out disciplinary letters to senior doctors, including those who've been covering emergencies at their own expense over the past 2 months. So we want to end this yesterday, but we are not sure if the employer is of the same mindset, or they just want to prove that they have power over doctors, or I don't know what exactly it is they are trying to prove. If government comes with genuine offers of negotiation, then we are more than happy to sit at the table with them and end this as soon as possible.